All right, this is a version of ChiroTouch as seen by the Google Glass. So what I'm going to do is I'm going to go ahead and pull up a test patient and enter it as test, and we're going to pull up a Medicare test patient, for example. All right, so we have this screen in front of us. Let me see if I can get it a little clearer. All right, so from here what we're going to do is we're going to go to our daily notes, and we're going to tell the computer that we are doing an initial exam with chief complaints on a patient that is coming in for an initial visit, and that today is the 18th. From there, we're going to say the person has just one complaint. We'll give them just one complaint today. And today we're going to say that complaint is, let's say it's a complaint detailed to the person's first name is going to be listed, and we're going to say that they have low back pain. From there, we're going to say their low back pain is rated about a 4 or 5, and then that there is tightness associated with this area, and that they're having this about 5 days per week. If there's any other additional information we want to add to it, we can just go under patient descriptions of pain. We can say it's throbby, burning, and stabbing. From there, we're going to go under next. We're going to go over etiology, and we're going to say that the etiology is, I don't know, for this pain, the etiology is unknown. It happened about a month ago, and that this date is an estimate. Okay. From there, I'm going to go over to this day. I put the year as 2014. Let's go back to 2013. It's easy enough to do. Etiology, just put a space in. Let's talk about things that make things worse or make things better for this patient. We're going to go over aggravating factors, and we're going to go over detailed aggravating factors. From there, we're going to say aggravating factors that does standing bother it. Standing does bother. Bothers what? Bothers low back pain, and this is noted in 20 minutes. We can say that walking does not bother it. Actually, walking makes it feel better, so we're going to skip that one. But sitting does bother us. We'll go back to low back pain. Sitting bothers less than 5 minutes. From there, we're going to say that bending over only bothers it with repetitive bending. And we don't need to say the time because it's repetitive. And here we can mark down any other things that aggravated or caused pain with it. We're going to go under palliative next. And under palliative, we're going to say that they feel better with rest, taking Advil, heat, and hot showers. From there, we're going to go under past medical history. And under here, we're going to say that this person has had no broken bones, if they've had no surgeries. We could list any traumas. Let me go ahead and put down Z, MVA. The patient stated they're involved in a motor vehicle accident in 2010. And from there, if we wanted to add any descriptive things regarding whiplash or things we can say that this person here has given birth to 2 children and that they do not have a pacemaker or a defibrillator. Just gets that question out of the way. From there, we can go under general history. We can say the person has had a heart attack and they are a non-gravid female. From there, we can say family history. There's a family history of heart disease and a family history of stroke. And from there, we're going to get out of that field. From there, we can go under objective findings. We can go under, again, our exam findings. Our vitals, we're going to go under vitals all. This is a person that is 5 foot 5 inches. They weigh, let's say, 150 pounds. Oops, clear. They weigh 150 pounds, and that they told us this. Their blood pressure was 120/80, and that they had a pulse of 64, respiratory rate of 16, and that their temperature was 98 degrees. From there, we're going to come out of here. We're going to go over a review of systems. We're going to say detailed review of systems, that this person here wears prescriptive bifocals. They do not have a problem with hearing, but they do have a decreased sense of smell. They have no problem with digestion. They do have diarrhea and frequent urination, and that they have a history of asthma. We can say also that they do not have any chest pain. We can also go further saying they do not have any skin rashes, or we could describe the rash if they had one right there. The patient has had a recent mammogram and the test was normal. So we'll get that. Person's not a male, so we'll take away prostate. Go into range of motion. So we're going to talk about range of motion. We're going to introduce it. We're going to come to the lumbar screen. And for the lumbar screen, we're going to say that the person, while we're examining them, had mild restriction of flexion, mild extension with extension, no problems with lateral flexions. However, they did have pain with flexion and extension. We're going to go ahead and add a period for sentence structure. From there, we're going to go right under orthopedic tests. Let's just go under reflexes first. Let's say that the lower reflexes were all normal, and that from there, we're going to go under orthopedics. We're going to introduce the orthopedic test. We're going to say that the complaint of low back was tested. Here's our low back. Adams was positive for the lower spine, and Eli's and Yeoman's were negative. From there, we're going to come out of here and go under palpation findings. They had muscle spasms located, tenderness located over L4 and L5. From there, we're going to say that they had muscle spasms located over the lower back. And from there, we could come out of this and say that the patient, for x-rays, has not had recent x-rays taken. If they had, we would list what they were taken and whether we were going to request them. And then from there, we're going to say that today we are going to take x-rays. We're going to take x-rays of the low back. The lumbar spine was taken. Lumbar 2 to 3 view. And from there, we can actually go ahead and go under lumbar findings. Lumbar 2 to 3 view show that the person had a normal curvature. The person had a slight listing to the right between L5 and L2, and from there that the person's George's line was intact. Shenton's line was not visualized, and there were no scoliosis noted. We can skip this one because of scoliosis. Body heights were benign. There was a decrease in posterior disc spacing between L5 and S1. Let me eliminate this letter and we can say that there is degenerative disc disease noted at the level of L3, L4. Very good. So let's take the word "and" out again for sentence structure. There is no anterior exostoses. There is posterior exostosis noted between L4 and L5. Let's take the letter "and" out again and add a period. And that there is no right lateral exostosis. There is no left lateral exostosis. And we'll say that there were no fractures, no soft tissues, and there is no transitional segmentation. However, there was an artifact noted of a zipper. From there, we'll get out the "and" again. And we're going to go over any other findings we would see. We're going to go under assessment. We're going to say that the daily assessment, they have a diagnosis. The diagnosis was not related to a sprained strain. They have multiple subluxations at L4, L5, right sacroiliac, and these subluxations are related to the diagnosis of low back pain. There is no sciatica. From there, we're going to come out of here and go under patient status. We're going to say that they're acute, they're under initial care, and that their prognosis looks fair to good. We're going to add any more comments of why it was fair. We're going to go under the plan. Today's plan, we're going to do a treatment plan for this patient with adjustments and therapy. We're going to say that we're going to see them 2 times a week for 1 to 2 weeks, and then we're going to reduce frequency. We're going to do 2 units of physical therapy per time. We're going to come out of here. Why are we doing physical therapy? That explains what muscle stim and heat are for. And then today's visit, we're just going to summarize what we did. The summary of today, we did an examination, we did x-rays, an adjustment. Let's go ahead and do some physical therapy on this person too. We're going to recommend some home exercises, and we're going to give a copy of this evaluation to the patient. So from there, we're going to go ahead and talk about what physical therapy was done. We did muscle stim and heat to 15 minutes right next to L5, and that was over the lower back. So put the low back right there. And then we're going to say this is done before the adjustment. So let's talk about the manipulations. We're going to introduce the manipulations. We're going to say the manipulations were performed, and how were they done? Well, we did Thompson on a prone position under the right sacroiliac joint, and then we also did a Gonstead push maneuver. We'll do right and L5 on the left. From there, we're going to come out of here, go into return visits. We want the person to return once more this week, and then from there, we're going to come out of here and go under home exercises. Home exercise is going to be introduced. We're going to say that we want the person to do the Williams exercises. We want them to do them daily, and we want to do 5 repetitions each, and then it goes over all the steps of the Williams exercises number 1 all the way through number 7. We're also going to say that we want the person to use a little bit of heat. We're going to do home heat therapy, heat for 15 minutes over the low back. And we're also going to go ahead and recommend that this person uses some BioFreeze, and we're going to give some samples of that to put over their low back. From there, we're going to go ahead and push save, and we can print out the evaluation report for the patient. If we go over to see what this looks like more, we can go under today's visit and just look what it looks like. We have an evaluation, we have chief complaints, we have aggravating factors, we have palliative factors, we have past medical history in detail, general health, family history. Talked about gait, we have their vitals, review of systems, range of motion, and all these things were from previous visits that are very, very similar to what we did today, but it's kind of easier to read it in this mode. If we come out of here today, again, our subjective findings, objective findings, assessment, and analytical and plan would all be listed there. All right, we're not going to save this, and if we had, it would be ready for the next time. All right, that's it.